Is humanity really missing a trick here? Yes, I think it is. Now, under the last time Donald Trump was president, he had this thing. I don't know what the legal status of this turned out to be. I don't think it was carried on, but President Donald J. Trump to sign right to try legislation for fulfilling the promise he made to expand healthcare opportunities for terminal Americans. So if people are dying anyway, people who are terminally ill should not have to go from country to country to seek a cure. I want to give them a chance right here at home. So what this paper is saying, and I would hope this is going to be resurrected under the new Trump administration, what this is saying is that if someone's dying and they want to try particular treatment, then why the heck shouldn't they be allowed to? Why should we be in a situation where someone who's dying wants to try ivermectin for their cancer, say? What on earth gives the state the power to say, no, you can't try that? I feel that legislation around the world should be changed to this, to give people the opportunity to try what the heck they want. You know, if someone's dying and they think, you know, I just think I quite fancy a large glass of single malt whiskey from the Isle of Lewis, then flipping heck, let them have it. Let them try whatever they want. And that goes for drugs that could potentially alleviate their condition. Potentially. Why not try it? And as people choose to try these drugs, we can build up huge amounts of evidence prospectively. So someone with a terminal condition may say, well, you know, I've got advanced prostate cancer. I would like to try taking ivermectin alongside my traditional treatments. Or some people might say, well, my traditional treatments have failed. I've now got metastatic prostate cancer. I'd like to try ivermectin on its own, or ivermectin with fenbendazole or some other drug. And then that data can be prospectively collected. And the people that chose not to have that drug, they would be the control group. And would end up by collecting huge amounts of data in very small amounts of time, rather than running phenomenally expensive, often biased, randomized controlled trials. Why don't we do that? We could collect 1 million pieces of data from combinations of countries in no time at all. Then we would know. And the potential for treatments for cancer at essentially zero cost would be available. Now I'm just going to close with another quick message from Dr. Kathleen Ruddy. Now we did look at a video clip from Dr. Ruddy just recently, and she talked about a patient with basically terminal metastatic prostate cancer who basically dramatically improved, essentially was cured, taking ivermectin. Let's listen to another account from her now, and then we'll close. For now, thank you for watching.
A second patient crossed my path. A guy in his 70s who had been losing weight for a year and a half, 40 pounds, not vaccinated, 40-pound weight loss, smoker, drinker, all he does is fish. And he could no longer swallow, and he could hardly talk. And so I got on the phone with him, and I said, Eddie, you know, tell me a little bit about your history and so forth. He knew someone with prostate cancer who had taken ivermectin, had cured himself from prostate cancer with that. So Eddie began taking ivermectin. I have no idea what the dosing was. He was just taking it. And I gave him some advice about diet and, you know, try and get the weight back on and so on and so forth. Within a couple of weeks, he sounded stronger. Sounded stronger. He could swallow. He had gained 6 pounds. His voice was better. Followed him for the next couple of weeks, maybe another month or so, and I said, Eddie, we need to get a scan. He doesn't have insurance, he doesn't like doctors, whatever. He had been diagnosed in that interval with 2 esophageal tumors, unresectable. Surgeons wouldn't go near it. The doctor said, well, we'll give you chemo and radiation, and Eddie said, no, you're not. So he takes his ivermectin. Maybe about 6 weeks later, I said, Eddie, you need to get a scan. I had to argue with Eddie to get a scan. We got the scan. No tumors. Gone. Gone. The problem was that he had sold his fishing boat. That was the biggest problem. He was getting better. His tumor was gone. Now he needed to go out and buy another fishing boat. That was the second patient. I was like, well, now that's interesting.